Hi, my name is Jasmine, and I'm going to be talking about what happened in the HSR course this week. So this week we was mostly based on the tutorial, which was led by Aunty Roma, and we watched a video about like the heartbreaking story of the Australia's stolen generations. And in this video and the discussions, we discussed how these people being taken resulted in them losing like their culture, like their identity, familial ties, and also how this had very long-lasting impacts on like their healthcare status, their poverty levels, and like mental health issues, and also a very systemic distrust and resentment of this other communities in Australia. And so Auntie Roma also we had a discussion about how this kind of racism still exists in Australia, and like one of the examples being in the foster care system, how these like children would be taken without good enough reasons, and how this all leads back to the racism that still exists against these Indigenous people. So I think it's very applaudable how Indigenous people are actively trying to make up for their identity loss and trying to help bridge themselves with their families, and initiatives such as Linkup, which is a familial family like help link up system, and also more of a social support network that like one of them is Uncle Archie. Is These both are very good initiatives that are helping these Indigenous people trying to um, get back what they lost. And so I think in a broader context, it's very important to understand that in healthcare, patients do come from different backgrounds, and not just Aboriginal and Torres Strait Islander, but like all different backgrounds, and how it's very important to acknowledge this and try to see where different people are coming from and respect these people. And specifically, as a future doctor who will be treating um, different kinds of people, and these including Aboriginal and Torres Strait Islander people, like specifically for them, I think it's very important to acknowledge that some of these patients may not know that know their family history, so maybe keep that in mind when trying to ask them questions about it. And a small gesture to make sure that they feel supported, maybe to put some flags up in like the clinical office to make sure that they feel respected. And so having this respect between you and them helps build like doctor and patient trust. And so they will be more likely to tell you their healthcare issues, and that results in better outcomes and treatment and outcomes of the patient. So, in conclusion, I think that it's immensely important to make sure that um, doctors respect different like societies and cultures, and make sure that we are trying to understand them, and make sure that we try to be respectful at all times to ensure that we will be providing the best possible care for these patients. Thank you.